My name's Olivia. I am a resident doctor here in East Harlem. I work at Settlement Health as a primary care doctor, which is on 106th and 3rd. We're talking about chronic obstructive pulmonary disease, or COPD. We're going to start with talking about what is COPD, define it, what puts someone at risk for COPD, how is COPD different than asthma. We'll talk about how people with COPD are at higher risk for different respiratory illnesses and what you need to know about related to that. And then we'll briefly talk about COPD treatment and vaccines. So we'll first start off by talking about what is COPD. The longer terminology for COPD is chronic obstructive pulmonary disease, and it really is a chronic breathing disease caused by different harmful exposures. And I want to kind of break down each of these parts of that long name to hopefully get us like a better understanding of what COPD really is. So when I say that COPD is a chronic disease, I mean that it's a lifelong disease, that there's actually no cure for COPD, but we have treatments to help improve symptoms. And when I say it's a chronic disease, I mean that symptoms typically get slowly progressive or slowly worse over time without treatment. It's also a breathing disease. So the most common symptoms for COPD are trouble breathing with activity, a cough, a chronic cough, mucus or phlegm production, and then frequent breathing infections. And then when I say that it's caused by harmful exposures, we'll talk a little bit more about what puts us at risk for COPD. But the exposures that were most commonly linked to COPD is tobacco, biomass fuel, and pollution. So just to really break down like the cause, what's going on when I say this is what happens in COPD. So we're often exposed to some type of exposure, often a chemical or tobacco, and that chemical is harmful to our lungs. That harmful chemical causes damage to our airways and our lung sacs in our lungs. And then that damage causes us to have a hard time moving air out of our lungs. So you might feel like you can breathe in, okay, but sometimes you have a hard time breathing out with a lot of force. That's like a really classic thing in COPD. And then that trouble moving air in and out of your lungs causes these breathing symptoms: cough, trouble breathing, particularly with activity, mucus production, and then frequent breathing infections. I put this slide up here just to kind of also break down some of the other terminologies that we might hear when we hear COPD. You might have heard two different words kind of thrown around: chronic bronchitis or emphysema. And so I just want to put this slide up here to show everyone that emphysema and chronic bronchitis are kind of under the broader umbrella term of COPD. And so when the smoke or other exposures damage our airways in our lungs, we call that chronic bronchitis. You can see here, you kind of get inflammation and damage to these airways, mucus buildup, and that causes a cough. Is really common. And some people don't even know that they have chronic bronchitis or COPD. If they have this, sometimes people just call it like a smoker's cough. If someone with a smoker's cough has COPD, that would be this kind of chronic bronchitis sign. On the flip side, if we get damage to our lung sacs in our lungs, not the airways, but the actual lung sacs, and I put kind of a picture of a honeycomb here because that's sort of what it looks like inside your lungs at a really, really small level. But if you get damage to those lung sacs, that's what we call emphysema. And people with more damage to their lung sacs in COPD typically have trouble breathing with activity, like walking down a few blocks of the city or trying to go upstairs. That's a really common symptom that people with emphysema form of COPD have. COPD can look different for different people. Some people have just a cough with mucus production. Some people don't really have a cough, but have a hard time breathing when walking down a few city blocks. So all that to say, COPD can look differently for different people. And if you hear things like bronchitis and emphysema, those are part of the larger umbrella of COPD. COPD is really common. In the US, for people over the age of 40, 1 in 10 people have COPD. So really, really common. And it's also one of the leading causes of death in the US and the world. I think currently it's the 4th leading cause of death in the world. Previously was the 3rd, but with the development of the COVID pandemic, that has surpassed it, but it's still the 4th leading cause of death in the world. And then one other quick thing to mention, we think of COPD, like I said, as a breathing disease, but it can also impact other parts of your body. So effects that are known to happen in the other parts of your body with COPD can be something called pulmonary hypertension, which is increased pressure in the blood vessels of your lungs. It can also be related to heart disease. People with COPD have some increased links to depression and anxiety, and you can have weight loss with COPD. So just putting that on there to think about, for someone with COPD, we want to make really important that you see your doctor because we want to make sure that we treat it and avoid any other effects to the rest of your body. We talked about COPD is caused by some harmful exposure in the environment. And the most common exposure that's linked to COPD is smoking, particularly cigarette smoke, but also linked to other forms of smoking through pipes or vaping even. But I'm most commonly talking about cigarette smoke. And the relationship to smoking and COPD depends on lots of things related to how and how long you smoke. So your risk of COPD is increased if you started smoking early, if you smoke lots of cigarettes a day, like a pack or more a day, if you stop smoking like very recently, or if you're still smoking breathing. And then you can also be at higher risk for COPD based on your secondhand smoke exposure. So even if you don't smoke yourself, or if you haven't smoked in a while, but you're in an environment where you get a lot of secondhand smoke, that can also put you at higher risk of COPD. I also wanted to talk about biomass and pollution exposure. It's different for different people, but biomass fuels, if you have frequent exposure to the burning of things like wood or garbage or oils, more specific types of burning like bioorganic materials, that can be linked with COPD. And then air pollution and wildfire smoke, again, maybe not in New York for wildfire smoke, but possibly air pollution can put you at higher risk for COPD. And then different work hazards. So if anyone works with coal or cadmium, again, much more specific, but those things can also put you at higher risk for COPD. Other things, family history of COPD, some childhood infections like HIV and tuberculosis, and personal history of asthma can also all put you at higher risk of COPD. I wanted to quickly take a pause and talk about the difference between COPD and asthma. And I think this is something that I get questions all the time in clinic. And I think it's really hard for us to do a good job of explaining the difference between COPD and asthma because they're two of the most common breathing disorders, and they can seem pretty similar when we're just having a hard time breathing, but they're really totally different lung diseases. And so I want to break down some of the main differences. So like we talked about, COPD has to do with exposures in the environment, like smoking and pollution. And so since that's what causes the damage to your lungs, we often don't see COPD happen until middle age. So people typically get diagnosed with COPD when they're age 40, 50, around that time of life. Whereas asthma is actually different. Asthma is like a different reactivity, a different baseline inflammation in your lungs. And that happens at a young age. So people are often diagnosed with asthma as children. I will say you could be diagnosed with asthma a little bit later in life too, but most commonly you're diagnosed as children. Asthma and COPD also have different patterns of how their symptoms change over time. So like we said, COPD, since it's a chronic disease, it often gets slowly worse over time. So you might get diagnosed at age 40 or 50, and then without treatment, your symptoms can slowly get worse. If you have COPD and you have a cough, maybe when you're first diagnosed, you have a cough once a day, a few times a day. And then the typical course of COPD is if you have a cough a few times a day, in a year, a few years, a decade, you might then get a cough a few times an hour. And then later in life, you might get a cough very frequently. That's kind of the typical time course of COPD. Asthma is not like that. So asthma, your symptoms vary day to day, and they're often worse at night or in the morning. Asthma, it doesn't slowly get worse over time in years. It's really kind of like you have a cough, maybe with exercise or maybe at night, and that's kind of stays the same throughout your whole life. Risk factors for the two diseases, like we talked about, COPD is really about exposures in the environment. So smoking or pollution, those are things that cause lung damage. Asthma, it's not the same thing. It's not related at all to smoking, and it's really not any chemical that causes damage. It's something more innate, more specific to your lungs. You might have a history of allergies or eczema that increases your risk for asthma, but smoking is not related to risk of asthma. And then the last one is, does albuterol help? And again, this is a little bit specific, but I think some people, even if you don't have COPD or asthma, you might be familiar with albuterol because it's pretty common. People have inhalers. And so I think it's important to know that albuterol does not often help in COPD. So again, we talked about how when you have that damage to your lungs in COPD, you have a hard time moving your air out. You have a hard time breathing out really strongly. Typically in COPD, albuterol does not fix that. There are other medications that we can give you that help you improve your COPD, but a typical albuterol inhaler typically doesn't reverse that in COPD. In asthma, however, it does. So that's really a big hallmark, and not necessarily something you need to know at home, but if you're diagnosed with asthma or COPD and you go see a pulmonologist, that might be something that they're testing to see, does it get better with albuterol? People with COPD are more likely to get respiratory or breathing infections. That's one of the common symptoms, like we said, frequent breathing infections. This can be due to a lot of different things. I think, we're still also trying to figure out exactly why, but inflammation and mucus buildup in the airways can make it harder for people with COPD to clear out the bacteria and viruses that might get in your lungs. And then also the damage from cigarette smoke or pollution itself can damage the immune cells in your lungs. All that to say, it weakens your lungs' ability to fight off infections when they are there, and it weakens your lungs' ability to move out infections when they get there. I also wanted to briefly talk about flare-ups because I think that's a really common part of COPD. So COPD flare-ups, or also known as exacerbations, are a very acute, quick worsening of your breathing symptoms. So again, if you have cough maybe a few times a day and otherwise are feeling good with COPD, a COPD flare-up might mean you start feeling sick, you are coughing coughing a lot, you're feeling like you're having a hard time breathing in a much quicker time span than normally would happen with COPD. So it's like a few days where you're feeling a lot worse with your COPD. And we call that a flare-up or an exacerbation. Flare-ups are most commonly caused by respiratory infections. Like we said, cold, COVID, flu, pneumonia. That's the most common cause of flare-up. And it can also be triggered by cigarette smoke, weather, allergies, asthma, or pollution. I also just wanted to make a quick comment about extreme weather, especially in the summer in New York City. I know it can get really, really hot. And again, in the winter, it can also get really cold. But I just wanted to make everyone aware that extreme weather can also put you at higher risk of COPD flare-up. So when we're having these heat waves over the summer, I just want people to be really cautious and self-aware that that can make their COPD worse. So as much as possible, finding a cool space to ride out the heat wave, which I know is really challenging for some of us, is just really important. And please talk to your doctor if you're worried about the extreme weather. I also want to just say that something unique about COPD is that people might not get back to their previous state of health after a flare-up. If your baseline state of COPD is coughing a few times a day, you might have a flare-up where it gets much worse. But then what's different about COPD is after that flare-up, after you're feeling better from that flare-up, you might not go back to coughing a few times a day. Even after you resolve your flare-up, even after you're feeling better, you then might start coughing more frequently. So you might be coughing a few times an hour, even though you got better from this flare-up. So I say that not to scare anyone, but just to really drive home the point that it's really important to prevent infections and flare-ups as much as possible to keep you feeling as good for longer. How do we prevent infections and flare-ups? One of the most important ways to prevent a flare-up is vaccines, to prevent us from getting those respiratory illnesses. Doctors across the country strongly encourage anyone with COPD and everybody to stay up on their vaccines to prevent these things. The vaccines that are really important for people with COPD to have is the flu vaccine. We recommend that you get that every year during flu season to, again, prevent the flu causing a flare-up. Newer, within the last few years, is the COVID vaccine. We recommend that everyone stays up to date on boosters. And it seems like we're going to be doing boosters every year, just like the flu. So really important to talk with your doctor about getting your yearly COVID vaccine. And then the other vaccine that's really important for people to get with COPD is a pneumococcal vaccine. And that helps you protect against pneumonias, which can also cause flares of your COPD. Typically, people without COPD will get the pneumococcal vaccine later in life when they're a little bit older. But anyone with COPD, once you're diagnosed with COPD, you should get the pneumococcal vaccine earlier. So talk with your doctor because there's a few different variations of which type of vaccine you should get. But just know if you have COPD, it's really important that you get your pneumococcal vaccine early. Other vaccines to just keep in mind is the Tdap vaccine that helps prevent whooping cough. Nothing super special about that vaccine for people with COPD, but every adult should have one dose as an adult and then one every 10 years. So since it has to do with preventing whooping cough, just really important to make sure you stay up to date on that. The zoster vaccine, which prevents shingles, everyone with COPD should get that age 50 or older. And then the RSV vaccine, everyone with COPD should get that age 60 or older. So these three bolded are the ones to make sure you really pay attention with for everyone, regardless of age. And then I want to briefly talk about prevention and treatment for COPD. The number one prevention and treatment if you're diagnosed with COPD is quitting smoking. Smoking, again, it's not the only harmful exposure that causes COPD or is linked to COPD, but it is one that's modifiable, right? So we can't necessarily change the pollution around us or the exposure to wildfire smoke, but we can try to cut down or quit smoking. And quitting smoking, even after diagnosis with COPD, really protects your lungs and decreases the damage that happens to your lungs after COPD. So even if you're already diagnosed with COPD, the number one thing you can do is quit or cut down on your smoking. Quitting and cutting back on smoking can be really hard for most people. I was a smoking cessation or a quitting smoking coach a few years ago, so I know firsthand that it can be really hard for people. I just want to say you're not alone if you find it hard to quit smoking. Basically, everybody that I know that tries to quit smoking has found it very, very challenging. Not to scare people, but just to show you're not alone if you're having trouble quitting smoking. I really recommend that you talk with a doctor that you trust because there are lots of medications that can help. There are lozenges, there are gums, there are patches, there are like tablets, pills you can take. If you've tried one medication, odds are that there's lots of others that can help, even if you found that that one isn't helpful. So definitely just talk with a doctor that you trust about how to help quit smoking. I also recommend trying to attend smoking cessation groups or speaking with other people that you trust who have successfully quit smoking because support and community is really important in doing something like this. If at first you don't succeed, try again. I think the statistic is it takes people maybe 7 times to successfully quit smoking. And if you don't succeed the first time, try again because it happens to almost everybody. COPD, every time you try to quit, and even if you relapse and smoke again, you're building those strategies, you're building that resilience, you're giving those lungs a break for even the time you've temporarily quit. So really every attempt to cut down and quit on your smoking is so, so good for you. Other treatments for COPD, physical activity has been shown to really increase and improve your lung function even after diagnosed with COPD. So just getting out, walking, doing other forms of physical activity that you enjoy can be really helpful for your lung function with COPD. Your doctor will likely prescribe different types of inhalers. And again, that's something that you can talk more specifically with your doctor based on what you need. But you might see these inhalers are really common. And then I would also recommend a spacer. Some doctors, we tend not to think about prescribing a spacer. Basically, a spacer is something that can help the inhaler medication get to your lungs better. So if you have just an inhaler, feel free to talk to your doctor and ask if a spacer would be helpful. I recommend pretty much everybody, including all adults, have a spacer. But there are different types of inhalers, some that you take every day, some that you take as needed, that your doctor might prescribe you if you have COPD, just depending on how your symptoms are. If you have a flare-up of your COPD or an exacerbation, if you're in the hospital or in the clinic with your doctor, they might prescribe you antibiotics or oral steroids. Those are different medicines that you might hear if you have a flare-up. And then less common, but common for people with more severe COPD is oxygen. People with COPD who have lower oxygen levels when they're at rest might benefit from some oxygen at home. So again, not something that everybody with COPD ends up needing, but some people do. Talk to your doctor if you have COPD or if you're worried that you have any of the symptoms that we talked about on how to prevent infections, treat these symptoms to help you feel better, and make sure that you're up to date on all your vaccines.